we want visitors to be in our hospital because we know that for someone that comes to our hospital for care, that can be scary. And we know that the most important part of their healing is to actually be able to have loved ones with them. We know that's a vital part of healing. And we've had to restrict our visitors back since about Christmas time. Now, at that time, we went to sort of what we're calling a red, yellow, green level of visitation. So we've been in the red level since about the winter holidays. And what that meant is that we really limited no visitors in the hospital. And where that red, yellow, green visitation sort of system came from is we wanted to look at three things. We look at what is the prevalence of COVID in our community, because that tells us about everyone that's coming into our building, the potential risk of them bringing COVID in with them. We also want to look at the number of COVID positive patients that we have in our hospitals. And the third category, criteria we look at is our ICU capacity. How full are our ICUs with COVID, but also just overall their capacity. And so what we see, based on what you heard Dr. McDermott talk about, is we've actually seen those numbers change. We've seen a drop in the prevalence in our community, those people testing positive. We've seen a drop in the number of patients that we have within our hospital that have COVID. And with that, we've also seen that drop in ICU capacity. So starting tomorrow, we will be reverting to our code yellow visitation. What that means, and all of this information will be updated on our website tomorrow. But what code yellow means for us is that we will be allowing one visitor per patient per hospital stay, meaning that we will ask patients to designate who that one person is that can come to visit while they're in the hospital. We'll be entering that information into their Epic chart so that when that person comes to the hospital each day to visit, we'll be able to check them in. Visitation hours are limited to 12 noon to 8 p.m. And again, so that's a way that we want you to be here with your loved one if they have to be in the hospital, but we're going to limit still the number of people that are in the hospital and the length of time that they're here. So by and large, for hospital inpatients, it's one visitor, same visitor through the whole hospital stay during the hours of 12 noon to 8 p.m. Now, it's a little bit different if you're someone that's coming to us to have a baby. And so for those moms, we do allow up to 2 designated caregivers, and those can be 24/7 because babies don't know to arrive between 12 noon and 8 p.m. And then also for children. So for any of our patients that are under the age of 18, we will be allowing 2 parents or guardians to be able to be with their child 24/7. In our emergency departments, it will also be 1 visitor. And I also want to stress that when you are a visitor coming into our facilities, we're going to be asking you a couple of questions, and we really need your help to make sure that we're really doing a thorough screening. So you're going to be asked questions about if you've had COVID, if you've been ill, if you've been treated for COVID recently, if you've tested positive for COVID, or if anyone in your immediate household has tested positive. And just because, what we've learned is, while you may be asymptomatic, you could still be spreading COVID. And we want to make sure that we can keep everybody in our building safe, our patients, our visitors, and our staff, and our volunteers, and our medical staff. So we ask that our community work with us and be honest when you're answering those questions. We want you here with your loved ones, but we also need to balance that with keeping everyone safe. So again, starting tomorrow, 12 noon, we know what that means here. There'll be a line at the front door, but that's also something that makes us happy because that lets us know that loved ones are being able to be here with their patients, and that's important to us.